All right. Well, I've just pressed record. So I'm Katie. I'm an osteopath. I'm also a weightlifting coach, and I'm here with the lovely Steph, who is a myotherapist and also a strength and conditioning coach who works out of Oxidate Performance, and she works with a lot of field sport players. And we're literally here today to just have a chat. We chat all the time about the little things that pop up for us as health professionals. And the question we kind of wanted to delve into today was, how do you find a suitable health professional for you? Because we get this question all the time. People are like, oh, why should I see an osteo over a myo or a chiro or a physio? And we just thought it would be a good one to just jump on a call and have a discussion about. And then you guys can kind of ask questions if any pop up for you. So Steph, what are your thoughts initially? Let's just freestyle.
Yeah, I think one of the first things that comes to mind is like clients saying, yeah, should I see a physio over an osteo, or when should I see one versus the other? And I think it's really important to think about, like, allied health or practitioners as a whole, we all have the same goal. We all want to help the client get better, but it's all going to be dependent on the practitioner in front of you, because some practitioners will work differently to others. Like one physio will work completely different to another physio. So I think that's number one, firstly. That's really, really important to think about. Don't think of it as, you know, this is one practitioner, this is another, you know, this is a physio field, this is osteo field, they only do this, osteos only do that. Think of it more as like an umbrella, and then you just want to pick the individual practitioner rather than the actual, like the name.
Yeah, because it's always like, oh, myo, so you do muscles, and osteo, you do bones. Is that right? Where it's like, yeah, that's not actually the way that it works. It's really, when you're working with a patient, you're working with the practitioner is a person. So they have a personality, they have a skill set, they have an environment, they have a background of education or maybe a bias towards something. And each individual is going to have a different experience with that practitioner. So we might have someone that finds that manual therapy or manipulation is the thing that makes them feel better. And then there's going to be a practitioner out there specifically that might suit them, versus someone who's like, do you know what, I really like to do exercise and I need some help figuring out what ones are going to help me feel better. And then there's going to be a practitioner that's going to suit them. So it doesn't mean that, oh, for exercise we go to physio, for manipulation we go to chiro, for muscles we go to myo, osteos just do weird shit because no one really knows. But I think it's more so like being able to find an individual practitioner that you connect with, that you can trust, and that speaks your language and kind of understands where you come from as a patient.
Yeah, absolutely. And I think the most important thing to remember and to focus on is, if you are coming in for a certain goal, like firstly for clients, like think about, before you're choosing the practitioner, think about why you actually want to go to see them. Like, what do you actually want to achieve out of it? Is it to become pain-free? Is it to just, you know, so you can feel a little bit, you know, looser if there's no pain at all, you just want to feel a little bit better. You know, I think that's the first thing. Figure out what your goal actually is, because then after you finish the treatment or the consult, you want to think to yourself, you want to ask yourself, has that goal been reached? Has that goal been spoken about? Are we actually on the right path? Do we both have the same understanding of what, you know, the client actually wants to achieve? Because you can have someone come in with, just say, back pain, and they want to move in a certain position really, really well, but then all their practitioner's done is just give them a massage and say, all right, we'll come back in next week. They've just walked out still with a bit of back pain. They might feel better, but can they still do that movement? You know, probably not. It hasn't really been addressed. So their goal hasn't really been addressed. So I think it's important as a client to make sure they get their message across to the practitioner, and also it's up to the practitioner to also be on board and be on the same page with the client as well.
Yeah, definitely. And I think like it's hard because when you've got an active patient or someone that's doing a sport, let's just say, and they're getting pain or irritation or discomfort during that sporting movement, my bias as a practitioner is to watch them do that movement. So like being in a gym environment, being able to watch someone squat, or if it is even bending over and putting my baby in a cot, like let's grab a 5 kilo sandbag and let's like reenact that movement so I can see how you're doing it. I can see if maybe the way you're doing it could be impacting the way you feel, or if there's something specifically that we might need to change whilst you're feeling sensitive or flared up. And I think like for a lot of patients that are getting pain during an active movement, they need to be seeking a practitioner that's going to help them like do those movements. Like an active problem needs an active solution versus kind of being like, all right, lay on the table. I'm going to manually check your pelvic ranges of motion or whatever could be something like that practitioner would go to, versus like watching them actively move. And I think that can be a really good hint when you're working with someone initially. Like, do they take you through an assessment? Do they get you to look, to walk and move and squat and lunge and do the specific aggravating factor? And can they like provide some kind of insight as to maybe why that would be happening? Like as a practitioner, you're not always going to know. So sometimes it is a bit of educated guessing, but we definitely want to rule out red flags. We definitely want to know that there's nothing really sinister going on underneath it. And if we just lay you on the table, maybe that's not addressing the full picture for the patient.
Yeah, absolutely. Absolutely. And I think for clients in particular, you've got to walk out knowing and understanding what you've actually done. And you've got to walk out with like a plan in your head. And I always say, if you can't walk out and tell a friend what you've just had and why, and like, your focus and what's actually going on, if you don't have a clear understanding that you can't explain to someone else, then it's probably, it hasn't been discussed properly. It hasn't been explained properly. And if your client can't understand it, then how can you expect to get results?
Yeah, because you're kind of like shooting in the dark, like you don't really know what you're aiming for. And I guess sometimes that can be my gripe with like manual therapy in general, is that if we're just applying it randomly, and we're not reassessing a goal, or we're not kind of looking at a movement and then applying it and then rechecking that movement, like how can we know whether the intervention is helpful? The other thing I suppose is if a patient is then leaving and they feel the need to have something done to them versus being able to do something for themselves to alleviate their symptoms, like I would always like to give a combination of both, so that when a patient leaves my treatment room, they're like, okay, we did some stuff that helped, and then she showed me 2 or 3 ways to make myself feel better, and then they have a strategy. So I kind of always say to a patient, like, ideally, I don't want to have to see you for the rest of your life. Like, I want to put myself out of business. I want you to not need me. So if we see each other 4, 6, 7 times, and then you're so clear and empowered and you have a plan that you then can fall back upon that plan when things go wrong or things flare up. And then if the plan isn't working, come back in. But ideally, you've got 1 or 2 exercises or safeguards for your sensitivity or area of sensitivity, and you can be like, all right, I'm going to try this. I remember last time Katie said that, I'm going to try this. I'm going to give it 2 or 3 days. If it doesn't work, obviously, then you're always there for your patient. But I think building that, like empowering your patient to be able to take control of their health is like a really big thing for me. And that's definitely a bias that I hold. But I really love that route of exercise and empowering a patient and basically wanting the patient to be a very, very active partner in their own health journey versus kind of just me being in charge.
Yeah, absolutely. And I think that kind of ties into, I think you did a post about it as well, saying, like, I'm not here to fix you. And I think that's something that your clients walk in with the expectation of, I'm going to go in for, to be fixed, and they're really, they're going to help me out, sort of thing. And yes, we're absolutely going to help you out, but we don't fix you, like you've got to fix yourself. We give you the guidance, we give you the information, we give you the tools that you need, but you've got to then go, and it's what you do outside that really, really counts. We just feed you with the information during the consult, but once you walk out that door, it's on you to use all that information that we've just given you. And I think that's really, really important in like, self-empowerment and being able to do that on your own without having to be like, a day later, crap, I feel sore, what do I do? Whereas instead it's okay, Steph's giving me the exercises, I know what I have to do, I'm going to try this out. Exactly what you said. I'm going to try these things out, see if they work, give it a couple of days, and then I'm seeing Steph next week, I can wait till then. Whereas if you walk out and you've had, no guidance, no plan, you've got no exercises, well, then you walk out and, you're left in the dark. You're left with, oh crap, I've got to go and see her again, maybe in a couple of days or next week, because I don't know what to do, And then that's when sometimes, if they can't come back in, they might go to a doctor. And then they can get someone else's advice, and someone else's advice might not always be, appropriate. Like I know with doctors in particular, not all doctors, but a lot of doctors will really push for like have scans, anti-inflammatories, really sort of passive things. And, if you put into a client's head, oh, I need to have a scan, you think automatically, gee, something must be wrong. It's very serious for me to go and have a scan. So it might not always be necessary if it's something very mild. So then you can go down the path of like instilling a little bit more fear. And then with fear, you tense up, you become a little bit more hesitant to do certain movements or certain activities. And then you fall in that trap of, not being able to do anything because you're just so worried.
Yeah. And that fear is real, because patients feel like I've just gone home and rested. I didn't go to work. And then you've got all of this kind of stuff snowballing, because it's like, I don't feel safe to move, so I'm not going to take my dog for a walk. I'm not going to do my normal activity or exercise, or go to my job. So it ends up that a patient becomes like really, really sedentary, doesn't really move their bodies, very, very fearful, like very hypervigilant. That obviously we both know can drive pain, but that, as well as stopping moving your body altogether, like that's going to also drive pain. Like we have all seen those patients or been those people that have had like a massive deadline or a big assignment, and we have to sit for like 6, 8, 10 hours because we're just slamming stuff out on the computer. And everybody knows that they feel worse for doing that. And it's very interesting because like when we don't move our body, generally people just feel very stiff, average, or painful. Yeah. So you come to a practitioner, and I guess in my opinion, our job is to assess them, make sure there's nothing really bad going on that could be dangerous to their like ongoing health or anything underlying that we need to kind of address. But then from there, once we've ruled out that nasty stuff, we want to promote as much movement as we can, because automatically if someone's been resting or fearful of movement, getting them back into a movement in a safe way is going to be the best way to get their body to kind of start feeling better again. And like that's manual therapy can be great for that, because if I have someone who's very scared to flex their spine and I do that in a passive way, like, and I'm like introducing that to their system, that's a safe way for them to do it. If they trust me and we're doing it together, that's great. So I might start like a consult with a little bit of that, and then we need to then follow it up with something active, so that the patient can be like, oh, look, I can pick up my keys from the floor. I can get out of my chair. I can get into my car. All of those things, like actually, they might feel a little bit sensitive, but they're actually doable. And I think the biggest thing I get is with patients that come in with like, let's say back pain, and they're very stiff and they're very sore and they haven't been moving because they're very worried. And they may have seen a GP or they've Googled stuff on the internet and been like, oh, I might have a disc, I might have this, I might have all these things. And then you take them through an assessment. And my assessment's relatively rigorous and it's quite long. So it can be 5 to 10 minutes of moving. So if they're moving for 5 to 10 minutes, sometimes they already feel better just after the assessment, because they've been moving their body after being really, really stiff and unsure for a couple of days prior to seeing me during the consult, which I think is probably a very interesting thing versus someone that maybe doesn't assess and just pops them on the table. It's kind of a different approach.
Yeah, absolutely. I think it's like for clients in particular that are dealing with pain and want pain to be resolved, it has to be through some form of movement, because the body loves movement, like the body adapts to movement. So we have to give it movement. So I think if you are a client and you are dealing with pain and you're going into a treatment and all they're doing is just doing soft tissue work, it can be very great short term, but that's not actually going to help address and then overcome that pain. It's got to be done with some form of movement. So I think that's really, really important to remember. So if you're seeing someone and all they're giving you is just massage work, then they might not just be, they might not be appropriate for you. It might be worth going to see someone else.
And I think like that manual therapy piece is really like in my head, like it's like a Panadol, like it's paracetamol, like it's short-lived. It can really, really help, but it needs to continually be topped up if that's going to be the only thing that you're doing for yourself when you're in pain. And I guess the other thing to remember from a patient perspective when we are having pain or injury is that, let's say you've got an acute injury, so it's something that's happened in the last couple of days. Let's say you've maybe sprained a joint in your back. There is a natural healing time of that without any intervention. So even if you don't come to see an osteopath, myotherapist, chiropractor, your back will get better on its own. It might take 2-3 weeks. having manual therapy isn't necessarily going to improve that time frame, but it can make it more comfortable, but so can exercise. So I guess having a visit with a practitioner and getting some education or some management about how to sit, how often to move, some drills you can do, as well as potentially the manual therapy piece, can then really empower the patient, because they know, like, in 2 to 3 weeks, I'm expected to feel a fair bit better. I should probably be back to full function. So even if I don't go back and I've got a whole bunch of management tools, like, I know that I'm able to kind of take control of what's happening with me. And I know that this kind of discomfort will come to an end.
Yeah, absolutely. And I think from a client's perspective, if you're walking into a treatment or, you know, a consult with some pain and you'd like it to be resolved, and you may have had experiences where, you know, massage has resulted in the past, so that's what you're expecting. I think if you're not seeing the same person you were seeing previous, if you're seeing someone new, you've also got to be open to the fact that they might give you a different form of treatment. Like, they might give you exercise, they might not give you, you know, massage. So I think you've got to be open to different movements and different different modalities, I suppose. Like different you know what I'm trying to say?
Different approaches, yeah, different biases.
Different approaches. That was the word. Different approaches. You've got to be open to different approaches. Definitely. Yeah.
And I think, like, if we are trying to do our best patient-centered care, like in our assessment or in our intake or our subjective history, we're going to be asking the patient what has worked for them. If someone says to me, I've sprained my lower back 8 times over the last 15 years, and I know that massage really helps, like, as a practitioner, even though my bias is exercise, and even though I want to just get you like squatting, lunging, pressing, pulling, whatever, I'm going to do that because I want you to feel better. But at the same time, I hope that throughout our interaction, you can build enough trust with me that maybe visit number 2, you might be open to some strength-based work. Because in my opinion, we need to build capacity at the tissues. If you're having a recurrent injury and you're having something that continues to happen, I don't think it's enough to just be like, cool, I'm going to massage you and make you feel better. I want to make an actual impact on your system so that this isn't something that keeps happening for the rest of your life. Like, if you've had reoccurring pain, like I myself have experienced back pain for a long time, and I don't really feel like getting manual therapy is enough for me. I need exercise, and I need management strategies, and I need ways to kind of like know that I'm actually making progress, because and that can be tricky, because if you're seeing a practitioner who's not offering that, you think that all you can do from a patient's perspective is just be massaged. So it's like, oh, I've just got a bad back, and I go get massage and I might get manipulated and I feel better for 2 or 3 days, and eventually I go back to normal, and then it happens again a month later. Whereas, like, I really am passionate about being like, let's stop that cycle. Like, I don't want you to have to come back in every 2 months. I don't want to have tune-up appointments. Like, I want you to commit to this process, and let's look at what's aggravating you in your lifestyle and how I can help you impact that. And I think that's the good thing about our education, is that we're taught to look at it from so many different perspectives now. Like, throughout our courses, it's not just like, oh, let's find the tissue causing pain and like trigger point it. It's like, let's look at stress. Let's look at mental health. Let's look at breathing. Let's look at work. Let's look at daily function and the things you do and the things that you don't do. And we can kind of tick across all those boxes and figure out, all right, there's some gaps in a few of these areas, and I have the education to help you fill those gaps, versus you just thinking like, oh, it hurts at my left lower back. Can you press on that for half an hour?
Yeah, absolutely. And that's exactly where like the education piece comes straight into it, because as a client, you know, clients aren't aware of that. Clients don't actually know. They're like, you know, it is our job to guide the client. It's not the client's job to actually know. It's our job to tell them and to teach them. So I think from a client's perspective, if they're walking in, you know, they've got a bit of pain, I think that the things that they want to make sure that is happening is that, you know, they're sitting down having a conversation. They're looking at their injury as a whole and not just focusing on that one area. They're going through certain movements that might aggravate the pain. They're talking about what makes them feel better. They're talking about whether or not they've had past treatments. You know, they're doing some movements. So like testing or assessment to see, you know, what areas give them pain and what movements they can actually do. They might do soft tissue work if they feel it's appropriate. but they'll probably give them some exercise prescription to make them feel better. And most of the time you might get, like, even if it's the smallest bit of relief, most of the time you will get that. You'll get some sort of small change, even if it's very small, you will get some form of change with exercise. And I think if then after that, you want to have a conversation about what, you want the client to understand what's going on, how long they think it might take, or even a discussion about how it might take a little bit of time. And then, the client needs to have an understanding of the plan ahead. Like, okay, what next? What exercises do I have to do at home? How often do I have to do them? Do I have a little guide to say, okay, if this is giving you pain, do this instead. Or, if this feels good, you can bump it up. Just a little bit like a pain sort of little toolbox. That way they can manage it on their own. And I think if you're not experiencing that during a consult, then that practitioner might not be right for you, especially when it's dealing with pain. If it's not pain and you could just kind of want to come in for like a loosening up, just kind of feel good, massage work was fine, it'll do the trick. But if it's pain related, you need to go through that sort of those stages or something similar to that. And I think if your practitioner isn't doing that, then it might be time to see another practitioner.
And I guess like it's interesting because you like take on patients who have seen practitioners and they'll be like, oh, I moved from another state and my osteo up there was fantastic. I was seeing them like every other week for 10 years. Okay, that's probably a bit of an exaggeration, but at the same time, like part of me says, like, without being rude to you, how is that fantastic? Because like, in my opinion, we've got a beginning of the rehab journey or like our pain journey or our function journey. And then we kind of have the end of that. And my job is to effectively help you step through that process. And if I'm doing my job correctly, I don't feel like you should need a long-term relationship with me that involves you seeing me every fortnight. Sure. Yeah. When people are like, especially in the athletic population, which is a lot of people that I work with, like when we're pushing our bodies to the edge of performance, there's probably going to be a more ongoing relationship because rehab is going to be progressive, programming, things like that. When you're going into a peak and you're going to compete, maybe you just need someone to help calm your system down. And this is when manual work can be really helpful. But if we're talking like an acute injury in a general population person, I feel like it should be a short-lived experience. And I don't know what your opinion on this is, but very much like, I don't want to have to see you because you feel that you need me every week. Like if I'm doing a good job, then you will come as you need me throughout like your life, really. Like not every 2 weeks for 10 years, I guess is my kind of long-winded point. Yeah. Does that make sense?
Yeah, absolutely. And I know with some chiros in particular, because of the adjustments, I know it's very, very common for clients to come in on a regular basis to have adjustments. And I think it's important to remember, if you feel like you can't go 2 weeks without getting an adjustment, maybe think of it in a different way. Think, why can't I go 2 weeks without getting an adjustment? What am I doing at the moment? What could I be doing differently? Could I be moving a bit better? Could I be adding in a little bit more exercise? Could I be, a little bit more mobile throughout the day? Like little things like that, because I think going for an adjustment, or even, it doesn't even have to be adjustment, just a treatment, a form of treatment every 2 weeks. It's not really, you're not creating any long-term change. You're not actually getting any benefit in yourself. You just you're becoming very, very dependent on the treatment. And we want to kind of do the opposite. We want to make you independent, so then you don't have to depend on us. So coming in every 2 weeks, like you just don't get that. You don't feel like you can comfortably go for 2 weeks without getting a treatment. So you just so fixed and dependent on, I have to come every 2 weeks, It's, all right, well, if you were to take a month off, you feel like your body would break down. And that's not because you're not capable. It's because in your head, that's, you've been guided to believe that you need the treatment every 2 weeks. And if you change that perspective to, okay, what can I be doing differently to make sure I'm not always having to go every 2 weeks, then that means you're more dependent on yourself. You're more independent. You're not relying on other people, and like you're creating long-term changes, because that's all they are, that, you know, adjustments, very short-term changes. And if you're going every 2 weeks, it is very short-term. You're looking at it short-term, and we're chasing the long-term results, because like you said, we want longevity. We want to make a difference, you know, over long periods of time. So you're not always coming back in, and you just can't achieve that by going for treatments every 2 weeks.
I just think, like, for me, red flags come up when a practitioner is guiding someone into a long-term plan. So if it's like, I want to sell you 3 treatments a week for the first month, and then it's going to taper off, and I want an upfront deposit of whatever, like, in my opinion, as a practitioner, like, that's just not really the best way to be getting towards your goals. And I think that it's overkill at best. There's definitely better ways to be good doing it. And that's like an old model that's potentially quite outdated, that needs to be evolved a little bit more. And I guess the other thing is, like, kind of what you said, what happens when a patient wants to go on holiday? I know no one can leave the country, but let's just say, like, post-COVID times, we want to go to Europe for 6 weeks, and I rely on adjustment or treatment every 2 weeks. That's 3 treatments I'm missing. Like, imagine how much that's going to impact me mentally on my holiday if I think I can't go without, if I think that I am getting put back into place, if I think that my spine's out of alignment. Like, if I have that kind of idea or narrative going on, because that's been sold to me by a health professional that I trust, I'm going to be really stressed out having to go away. And like, I've seen patients that have been like, oh, I've moved my appointment a week early because I'm going away on camp or something. And I know I needed to see you. And I'm like, no, you didn't. Like, you absolutely didn't. Is your pain any worse? No. Is your function any worse? No. Like, you've got the tools to continue whilst you're away. Like, we could have effectively gone longer. And I guess, like, this is a contentious opinion, because a lot of health professionals are like, no, I need to see you weekly for the first 4 weeks. And there's a whole kind of like layout that we get taught at uni. But like, in my opinion, it doesn't always have to be like rigorously adhered to. And if we're truly trying to empower patients, then we should be focusing more on that versus focusing on the rebooking and like having them really rely on us. I want to think of myself as like, I'm a map. I'm going to help you get to where you need to go. But at the end of the day, you have to put one foot in front of the other and walk there. Like, I'm not going to carry you. And that's like a pretty big part of my treatment modality. And there's 100% people that don't want that. There's people that don't want to change. They don't want to be challenged, and that's totally fine. And I'm here for them when they're ready. If not, there's lots of fantastic practitioners I can refer them to that might do a better job at managing that. But for me, the patients I enjoy working with the most, and I find that I get the best benefit out of, or benefit for, or benefit with, is the patients that are willing to be empowered and be active in their own journey. So I guess let's just like summarize what our opinion is in regards to how you would look for a health practitioner. So number 1 was, we don't really care what they are. They can be a chiro, a myo, an osteo, a physio, a dry needling, Chinese medicine, acupuncturist. They can be a healer. They can be any of those things. Title isn't important. That's probably our number 1. What would you say others are?
Yeah. I think number 2 is establish like why you actually want to go and see that practitioner. Like, what is your purpose? What do you want to achieve from seeing them? That's definitely number 2. Or would you go number 3?
Number 3, I suppose, like, you've got your purpose and you want to have a practitioner that's actively helping you set goals, and that goal, there's a plan to get to that goal, and you know what that is. So I think that's probably like four points in one, but
yeah, absolutely. That's sort of like, if we break down that 4 as a title, like wanting to, you know, like wanting to dive into the goals, you know, together and establish a plan. Underneath that would be, you know, have they tested you for like specific movements? Do you talk about whether or not the pain, you know, certain movements irritate you? Do you talk about what movements make you feel better? Did they give you guided exercises? Did they explain why those exercises are important and how it's going to benefit you? Did they give you an exercise program to follow when you finish the treatment? Did they give you a guideline on what you should be doing outside of the treatment? I think that ties into that whole establish a goal. Point 4.
Like, for me, like, the last one would probably be like, and this is probably pertaining more to athletes, but like, do they understand your sport? I think that can be really helpful. It's not 100% necessary, but I think it can be helpful. And I think for me, like the last point is like, do you trust them? Do you feel like they listen to you? Do you feel like you were heard? Did they ask enough questions? Did they interrupt? Were they there for you and your experience? Like the treatment room can be like a bit of a sacred space. Like there's a lot of things that come out. There's a lot of things that get confided. There's a lot of deep things that we have to discuss. And do you feel like that practitioner was showing up for you? Do you feel like that practitioner was listening to you? And do you feel like they cared about getting you to where they want to go? Like, because like, I think a very interesting thing that was said to me throughout studying was like you're an osteopath or a practitioner to a lot of patients. So for you, they're just one patient, but for the patient, you're their person. Like you're their healthcare provider. Like you're their osteo, you're their myo, you're their coach. Like you're their go-to. So if you can't have that like empathetic, like reciprocal relationship with your practitioner, then they might not be your person. And that's totally fine. Like there's going to be some people that come see me and they're like, she's annoying as shit and I want to go somewhere else. And like, I'm not offended by that because I'm going to have better outcomes with somebody that feels supported and heard and encouraged by me. And if I'm not that person, like I'm 100% down to refer.
So point 5, did they hear you and did you feel heard? Basically. And I think point 6, to summarize and finish it there, would be do you understand what you have to do? Like, do you understand what's going on, why it's happened, and what you need to do to get back to the way it was before, to get back to moving pain free, or whatever it was, get back to moving that position without hesitation. Like, do you know what the plan is, and do you actually understand it? Can you explain it to someone else?
Awesome. Good summary, mate. I think we need.
I'm done.
Awesome.
So I think if those points aren't those points aren't ticked off, then I think you're definitely worth seeing another practitioner.
Totally
for
agree.
sure.
Totally agree. Awesome. Well, I'm going to press